Hi, Dr. Bregman.
Hi,
Good
Linda.
afternoon.
Same
How are
here.
you?
Pretty good. Pretty good.
Wonderful, wonderful. Well, we're getting in a lot of questions, and I have some questions that seem to be a lot of the same, which has to do with panic attacks, which would seem kind of natural during this, uncertain time that we're in. People that might have anxiety would maybe go into full-blown anxiety attacks. So this email is from a lady named Lori. It's coming from Jacksonville, Florida, and she writes, Dr. Bregman, I'm 65 years old. I've always had a little anxiety, especially when it comes to new situations. Lately, though, I've been suffering full-blown panic attacks. How do I manage these scary episodes?
Okay. Well, Linda, this is probably a problem that's, occurring much more often than we could believe.
I would imagine.
And is a disabling problem. If you have a panic attack, you could be heading to the emergency room. You think you're going to die. Your heart is pounding. You're sweating. And you can't stand wherever you are.
Yeah, it's horrible.
Totally and if you think if you have one, then you're afraid you're going to have another one, and it changes your life too.
Yeah, so it kind of feeds off of itself.
It does. And what's happened is it's only really been in recent times that regular private practice doctors have gone to appreciate it. What happened would be people would come to the emergency room, to the doctor's office with these kind of symptoms of him, and they'd be taken to the hospital. They're given EKGs because they say they're having a heart attack. They have workups that cost thousands of dollars. And it's been recent times that doctors have become much more sophisticated and say, okay, well, we'll do an EKG, a little bit of something, but let's not go overboard. Maybe this is a panic attack. So the rule out of a psychiatric disorder is top of mind now with people with these symptoms that we just talked about.
But how do you manage this without having to go to the emergency room? I mean, if you really know you are susceptible to panic attacks, how can you manage this by yourself? So, okay, I feel this coming on. What do I do? Do I breathe differently? Do I do meditation? Is there a pill I can take? What do I do?
Okay, and that's an excellent question. First, after you've had one or two and you've been to the emergency room, you have to convince yourself that, okay, there's something wrong here. Emotionally, I am not having a heart attack, because it's sometimes very difficult for people to switch over, that this is really me, I'm emotional. So what could be done? Well, that, first of all, that awareness, okay? And, Linda, honestly, this is a disorder that really needs intervention. If you're having ongoing panic attacks and you've been to the emergency room, then let's have you go see somebody qualified to help you out. And this is what they would tell you. First of all, I'd want to know, do you have a family history of anxiety disorder? In other words, it runs in families. I've seen football players that are scared to death they're going to have a panic attack, and they're like these big men, they're like frightened. So it can happen to anybody. It runs in the family, so take a good history. Then there are some medical problems. People with a mitral valve prolapse, which is not an uncommon thing. It is a cardiac issue, very common to have panic attacks. So if we could rule these things out and the people are, in decent health, then we think about helping people to understand some medical management and some coordinated therapy to look at their triggers. And honestly, Linda, I can have 100% cure rate of this. some of the medicines we have today are so specific for panic, and if they're used correctly along with therapy to help people get to understand their triggers, they could be panic free in a short amount of time. Then they could learn in therapy how to deal with the triggers and then become off the medicines. So it's very treatable.
Well, I know a lot of performers or people on the air, television, that would get, like, before going live on television, very intimidating, that would get a panic attack. Maybe if you get a panic attack every once in a while, what can you do? Maybe you don't need medication. What can you do to talk yourself off that ledge, especially if it's a performance situation? And you really don't want medication, you want to be really focused. How do you talk yourself off that ledge?
Well, and people do, and the number one fear is public speaking.
Mm-hmm.
I mean, just like so, I'm sure it is a variation of public speaking, and there are ways to coach people to help them. Like, for instance, Dale Carnegie's books. He was very helpful. You should read some of those. And one of the things I help people with initially is pick somebody out in the audience that you like, and make believe you're with them and you're having a conversation and you're talking to them. Now, meditation before helps, listening to music before helps. These are all things that could help people. Practicing, in front of, some people could help. There's a lot of good information out there to help people. But if it really gets bad, there are also medicines such as propranolol, which we've used for years to help people who have stage fright, especially, not just having a panic attack. So there are medications, there's the benzodiazepines too, and the serotonin reuptake blockers that we use, but people can help themselves.
Well, it sounds like try mind over matter first, and if that doesn't work, talk to your therapist, your doctor, and get on some really great, modern, effective medicine.
Exactly, and it's definitely something that could be cured. You don't have to live with this.
No.
So get some help.
Thank you.
BregmanMD Medical Group offers online psychiatry and online therapy.